everyone. I am 23 weeks pregnant and today we are going to practice some yoga for the shoulders and the upper back. Find a very comfortable position, which can be in mermaid pose. Crossed legs, unless you have a pelvic pain. Then in that case, just keep one leg extended in front of you. Right or wrong, just listen to your body and to your energy today. Let's start by taking one hand to the heart and one hand to the bum and taking some deep breath in and out. And with every breath, just allowing your body to relax a little bit more, allowing the shoulders to relax. Just few big breaths in and out. As you inhale, try to expand the belly. And as you exhale, they inflate it. Bringing in as much oxygen as we can. Try to sit straight, as if you had a wall behind you. And relax the shoulders, relax the face. And just breathe. Allowing the body to settle before the practice. A couple more breaths this way. And when you're ready, just open your eyes. You can practice with your eyes closed, or if you prefer, just keep a soft gaze towards the floor in front of you. We're going to start with our hands on our shoulders, and we're going to take some rotation. Breathing deeply as we do this movement. This exercise is really good for creating space when you have upper back pain and keeping the movement fluid, connecting with the breath. Simply breathe. Extend now your arms, and we keep moving the arms, alternating them. Inhaling as we bring them back and exhaling as we bring them forward. Really creating space in the upper chest to breathe better and to release any aches, mental or physical, that you might have. Carrying the world in our shoulders and dropping them. In here, we're trying to create lots of space for us, for our future, and for the baby who will join us in a few months. The more you breathe deeply, the more you can drop in a calmer state, which is exactly what we want in the future when we give birth, to be more in tune with our body, knowing that our body holds the answers. So keep the movement slow and connecting with your breath. Pregnant woman can do this really easily. So just trust whatever is coming up. And if the mind wanders, just bring it back to the movement and the breath in the here and now. Let's do now some shoulders roll. Inhaling as we bring them up and exhaling as we let them go. Really expanding the upper body. Expanding and releasing any aches, any pain that you might have. Let's now, if you're crossed legs, let's swap the legs. Bring the leg close to your groin and the other one just in front. We don't want to cross them too much because that can create problem with your circulation and having cramps and such things. Breathe, connect once again with your baby. And let's bring some movement to the neck. Just look left and right, keeping your spine straight. Really gentle, don't push yourself too much. Just enter in this state of calmness, keeping the connection with your baby, whatever that means for you. You can let your baby know that you're here today, practicing yoga on your mat, just finding time for yourself. Don't overextend the neck, just bring the movement gentle, being kind to yourself, accepting where you are on your journey. And breathe deeply. We now move the neck up and down. Careful to do not overextend it. But keep the movement gentle, keeping the spine straight. Come now, sitting on your knees, if you're not already there. Put a pillow behind your back and let's do some cat and cow. So we inhale as we open our chest up, and as we exhale, we round our back. So we inhale and we exhale. Keep the movement once again very gentle and listen to your body. Bringing the scapula together, opening the chest. Really creating space in the upper back. Careful to don't put too much pressure on the sacral region, because we don't want a full back bend, because that could create more pain and aches to the lower back. So keep your hands actually on the lower back and see if you can get a sense of also the pelvis tilting forward and backward. This is a very good movement. All the pelvic tilt to help the baby in the optimal fetal position. And remember to breathe and keep the movement gentle, being nice with yourself. From here, we go now on all four. Making sure the wrists are aligned with the shoulders and the knees with the hips. To find a neutral spine, you can tuck your toes under making sure you don't drop too much or you're not like in a very weird position with the spine. We want the spine to be neutral. Once you have found it, you can slightly bend your elbow. If the wrist hurts, you can keep your fist closed, or you can keep a blanket underneath. And from here we relax the feet, so on the sole of the feet. And as we inhale, keeping a neutral spine, and we exhale and we round the back. What we don't want to do here is going in a full cat and cow, because again, we don't want to put too much pressure on the lower back, because that actually will bring more pain. So we just exhale, around the back, inhale, trying to bring the scapula together, but don't drop the belly. Inhaling here and exhaling around in the back. And we do a couple in here. And we pass here to do some circles. So we inhale and we exhale and we come back. We inhale, the head is moving first, and we exhale, we come back. Really following the flow and the movement. And go on the other side. Inhaling, head first, exhaling, coming back. This once again is a very good movement for the back, but also to bring the baby in the optimal fetal position. So if you're in the third trimester, this is a great movement to do. Let's rock forward and back. Stay a little bit larger now with your knees. Sit on your heels if this is comfortable. You can also put a blanket in between. Fists together, or you can use a pillow. And we just come and rest for a couple of minutes in child pose. Keeping your legs as open as you can to make space for the bump. You can rest on your fist. You can rest on a pillow, just taking some moments here to reset and relax before we move ahead for today. From here, it's really good if you can take a bit of time coming down in Shavasana or lying down on the bed to integrate the practice for a few minutes and rest. Hoping this is going to be helpful for your back. Let me know how you feel and see you next time. Namaste.